Good evening and welcome to the Daily Drum for this Thursday, October 30th, 2025. I'm Alette Green. Harold Fisher has the night off. It's nice to be here with you all this evening. So tonight, we're talking about a new effort in DC to address a shortage of healthcare workers while also providing training, college credits, and job opportunities for city youth. It's part of a unique initiative called the DC Healthcare Employment and Apprenticeship Link Program, or DC HEAL for short. Now, it's not just filling jobs, it's changing lives, especially for inner city youth who now have more pathways to purpose and possibility. So, tonight we're going to hear from a student who's already walking that path and from DC's Deputy Mayor for Education, who is helping to make it all happen. So let's introduce our guest this evening. Tonight we have Paul Kihn, DC's Deputy Mayor for Education, with us. Paul, thank you for joining us.
Thank you for having me.
Wonderful. And Nykirah Harper, a student at Cesar Chavez Public Charter Schools, is here with us tonight. Nykirah, how are you?
I'm good, and you?
I'm wonderful. Okay, I love this program and what it's all about. So let's talk about it first. Paul, tell me a little bit about the new apprenticeship program. How does it fit into the city's broader education and workforce strategy? This is situated in Ward 8, right?
That's correct. And we realized as we were coming out of the pandemic that we had to do a lot to provide new forms of shared programming for every single public school student in the city. Our high school students should not just be constrained by what their schools offered them. Mm-hmm. We had to establish advanced technical centers where students from all over the city could come and, as you said, get really wonderful programming in health, in cybersecurity, where they would get high school credits and college credits and real hands-on learning opportunities. So we stood one up in Ward 5 a couple years ago, and so far we've given out more than 4,000 college credits worth more than $3 million to those families. And this year we said, you know what? East of the river in Wards 7 and 8, we don't have any health science career programming yet, so let's start one there. And we just started that one this September.
Oh, I love it. Okay. So let's go back. Earlier this month, Mayor Bowser joined Bloomberg Philanthropies, local education and healthcare partners to really celebrate the opening of this new Ward 8 Advanced Technical Center and to launch DC HEAL. This is extraordinary to really focus on the Ward 8 community, that part of town, and to really bring in, this new plan for young people to take advantage. It brings new hope.
Yeah, it really, really does. And we could not be more excited or more proud. And you're right to mention Mayor Bowser, who's been steadfast in her commitment to this, Bloomberg Philanthropies, which allowed us some private money. But the important thing about this is that it comes from an incredible coalition. This is not the kind of thing that city government can do by itself, or employers can do by themselves, or higher ed can do by themselves. So we got together this incredible partnership with government, with the private sector in the form of Bloomberg and others, with the form of employers, because we made the really powerful decision to locate this center in the new Whitman Walker Health Center in Ward 8. So the young people like Nykirah and others can actually go to see the workings of these healthcare professionals. These healthcare professionals, nurses, doctors, and others can come down and talk to the students, so they're really in the mix, as it were, as part of their hands-on learning experiences.
Nykirah, I'm coming to you in just a second. First, Paul, tell me exactly how it works for the students, how they get involved, how they're selected, and what is a typical experience like? Break it down for us.
There are actually two phases to this, and you have helpfully mentioned both. The first is for any high school student who wants to experience career training in the health sciences or cybersecurity. They have the opportunity to sign up for these programs and to go to these advanced technical centers, again, where they get their high school credits for graduation, but they also get college credits and access to internships. And we currently have high school students from, wait for it, 25 different high schools across the city attending these shared hubs. 25 high schools with almost 400 students who we provide transportation for to get there. So high school students, if you're out there listening, talk to your guidance counselor, ask about the advanced technical centers, and you can get access. The second part of this is the one you
Uh-huh.
mentioned, which is the new DC Heal apprenticeship, because we realize we really want to support our young people, not just when they're in high school, but once they finish. If they're interested in careers in health, then we can offer them now these new apprenticeships where they are paid, where they get placements in a variety of local hospitals and healthcare settings, and we continue to provide the credentials that will set them off on great careers. So it's really these two phases. The first one for those that are in school now, and the second one for those who graduate.
I love it. Okay, Nykirah, let me bring you in here. How did you hear about the program and sign up for it? What made you want to do this?
So I was a sophomore when I first found out about the program through my counselor, and he picked me. He was just like, go give it a try. And the first pathway I chose was cybersecurity, and I was there for a while, and then I realized cybersecurity wasn't my thing.
Okay.
And then at the end of last school year, they introduced to me the EMT pathway, and I've always had a thing for like first responders. Like I've wanted to be one since I was younger. So he came to me and he like
So you think that's what you want to do? You want to end up going into that field professionally after you're done with this?
yes. And he told me that there was a new pathway, and he asked did I want to try. And I told him yes. And I've noticed that since I've been here, I've been thriving.
You said you've been what? Vibing?
Thriving.
Thriving. Okay,
Yes.
thriving. Okay. I like vibing and thriving. I love it. So tell me so how does it work for you? How often are you going? Explain it so people listening and watching can really understand and see how the program works for you.
The ATC runs on the DCPS schedule, and I come here every day that DCPS schools have school, and my class start at 1:40 p.m. and ends at 3 p.m. And in class, well, right now we're in medical terminology, so we're learning the basic medical terms right now.
Yeah, that's what you've been learning right now.
Yes.
Okay, and none of it is scaring you away. It's just drawing you in more and more, huh?
Yes.
Before you signed up, or you said that you got picked. Before you were selected for this, what were you thinking about a career for you? Were you thinking about that at that time? Do you have any thoughts about what you wanted to do? I mean,
Not
you
really.
tried cybersecurity first.
Yes. I didn't really have an idea what I wanted to do.
And so, Paul, that brings me to this allows young people to really test out some things. She said she tried cybersecurity, that part of it, that really wasn't her thing. And now this healthcare pathway is sparking her interest. That's what we want.
Absolutely. I mean, this is all about access to opportunity. We want to ensure that every single child, every single youth, every single teenager in our city has the opportunity to thrive, as Nykirah says she's doing, and to live up to their fullest potential. And that means we got to be able to try things and make some mistakes and get up and try again. That's all about the kinds of perseverance and resilience that we want. And we've got to get exposed. We must allow our young people to be exposed to different ideas of jobs, different professions. We are getting every single youth in the city ready for college, but not everybody is going to go to college right away. They may put it off for a little while, or they may decide to embark directly on a career path. And so what we have to do as a city and what we have to do in our schools is make sure we're providing access to many opportunities so that young people can find different pathways, ones that suit them best, but all of which land them in a really good career.
I love that. Nykirah talked about trying cybersecurity, and now she's interested in the EMT. Tell me about the healthcare career opportunities that are offered through this.
So we essentially do the following very simple thing. We go to all of the healthcare providers in the city, in this case through our DC Hospitals Association, which is our wonderful partner, and we say to them, where do you have job openings? And of those job openings, which are the ones that when people get into them, they're going to have a chance to advance in their career? And so they tell us, and literally those are the opportunities that we then provide. So we are working very closely with the employers, in this case, the healthcare providers, to find out where they've got job openings, where they expect they'll have job openings in a few years, and also which ones are the ones that people go into and then continue to progress from. So the platforms of them. So that's what we do. We're doing EMT certifications. We're doing the patient health tech certifications. We are doing the nurse assistant certifications. So we've got a number of different healthcare certifications and job placement opportunities, all of which are really the beginning of something wonderful for people as opposed to an endpoint.
Paul, tell me, how are hospitals, clinics, other healthcare providers, partnering to make this apprenticeship experience work? What is their role? How are they actually participating?
Yeah, we couldn't be happier with the extraordinary passion and dedication of our hospital and healthcare provider partnerships. So specifically what they do is, in the first place, they're the ones that we talk to about what their jobs and job openings are. Secondly, we've got a very special partnership with Whitman Walker Health that stood up and said, yeah, we want to actually go shoulder to shoulder with you in this endeavor. And we have space in their facility, and they're leaning in, again, to help with the instruction, but also the placements in their center. All of the others basically say, all right, we're going to provide a certain number of placements for your apprentices. And what they do is they actually take the time to say, we can take 3 folks in this facility or 7 folks in this facility, and we will have the staff there that will help to shepherd and educate them as they are placed with us. So they literally do give us the job placement opportunities that our young people take advantage of. The other thing I'll mention is that, as I said, the first one of these advanced technical centers we started is in Ward 5. It's actually very close to the station. And that was a standalone building that felt and looked a lot like a school. And we said, hey, we've got to make the connection with employers deeper. So we are now working with Children's National and with MedStar, and they are opening community health clinics in that building. So not only are we filling a desert that's in that neighborhood for healthcare for residents and the community members, but also now we have these great placements for our young people to, again, go down in the same building and help with the care of patients as they learn these new skills.
Oh, that's really good. Nykirah, what exciting things have you learned? What's been the most rewarding or exciting so far? Or have you gotten to that point? Because I know you basically just started the program, the apprenticeship.
Last week we visited the actual EMT training site, and I felt like it was very interesting.
Yeah. What did you see?
We
Did you get to touch the equipment and that sort of thing? Tell me what you saw.
It was very hands-on. We got to practice on mannequins. We even went through some big scenarios of what could possibly happen and how to go about the situations.
I think this is really eye-opening for you and for so many young people who might go down this path, don't you? I mean, have you ever wondered what the folks in the ambulances and actually do when they go down a street? What do you think?
Yes.
Has it been eye-opening for you?
Yes, it has been very eye-opening for me. I've got to actually not see behind the scenes, but at the same time see behind the scenes and learn more about what they do and
Yeah,
what they do
yeah.
it.
And what do you think about the life and death aspect of being part of someone's, life-saving experience? Have you gotten to that thought process in your head yet?
Um, I've always liked helping people, so I felt like this job would be perfect for me.
Yeah, yeah. So what have you shared with your friends? Are they coming on board to do something like this? Not even necessarily this, but maybe the cyber part of this opportunity. What are they saying? What are you sharing?
I have a friend in this class with me, and we kind of said that we'll be in this together, like, and so far we're liking it.
I think that's great. And I think you need to tell other friends, like, check it out. Here's another opportunity, right?
Yes.
Yeah. Um, Paul, I mean, this hits um, a need in the community, especially when we're talking about providing opportunities in the healthcare field, which is the field of now and in the future. These are where the jobs are going to be, and I know you know that, and I know that's why this part of it is being offered. What what do you see this serving in terms of filling the undeserved representation in healthcare fields by the Black and Brown community? Have you all been able to crunch some numbers, or even look into your crystal ball on this?
Well, essentially, what we know to be true, as I said, is that east of the river, in some of our lowest income communities, certainly largely Black and Brown, there were literally no high school health career programs in any of the high schools. And we know that that is an issue of equity, that's an issue of fairness, that's an issue of
Yeah.
justice, that's an issue of access. And so as we looked for the right place in our city to locate a new one of these shared program hubs that will provide access to really terrific learning, college credit, and jobs, it was exactly the right place to do that. What we're trying to do is make our training systems, our career preparation systems, our talent systems much more agile, because we no longer want to be in a situation where, on the one hand, schools or workforce training providers are simply deciding what to do, training folks, and then hoping for the best. What we want to be doing is going to the employers and saying, what is it that you need? And then making sure that all of our young people know about those needs and have access so they can make choices that will, if they choose one of those things, will guarantee them access to a wonderful job. And I think we all know and read a lot about the so-called future of work and the future of our economy and the uncertainty for young people coming up today. So we know that it is absolutely an issue of racial justice, an issue of resident justice, an issue of economic justice, to ensure that our training systems are preparing people much more agilely. Because we want every one of our young people from DC to get jobs. Here in DC, that's our goal. And we can only do that if we listen carefully to what employers are telling us about what their hiring needs are going to be. And our systems are designed to ensure young people like Nykirah and others are offered opportunities to get those actual jobs.
And beyond the job training that you guys are offering with this, how does the program support the students academically or emotionally, so that we can ensure that they succeed?
It's one of the most beautiful things about the way we're running the program. It's such a wonderful question insofar as the students that attend the advanced technical centers stay completely connected to their home schools, their communities that they know well. So Nykirah, for example, goes to her school in the morning and then travels to the advanced technical center for her afternoon classes. But she's got, and I'm sure, Nykirah, you could tell us all about some of your wonderful teachers at school that you stay connected with, those that support you. And at the Advanced Technical Center, we've got wonderful leaders and adults and educators. And I hear from the young people at the centers how connected they feel and how supported they feel. Once you go on your apprenticeship, of course, we have many wraparound supports for you to ensure that you have the right mentorship and coaching, a place to go if you encounter difficulty. We never leave you on your own, because we know that the most important thing for the success of young people in these new environments like work and college is that we support them and that they're supported by their peers. For a lot of folks, it's the first time. For a lot of folks, it's the first time in their generation that someone is going off to do, for example, college. And we have got to make sure that we've got the wraparounds in place. And we know the evidence tells us that that works.
That is so critical to ensure their success. Okay, so people are watching, people are hearing about the amazing things that are happening with this. So how can people get more information and sign up to do this, Paul?
So for the advanced technical centers, your best point of contact are your public high schools. So if you
Okay.
have a young person
So
in a,
in all of the public high schools, there's information for those young people.
absolutely, go to your
Okay.
guidance counselor. You will get the information you need.
And so some of the participants in the program have already graduated from high school.
That's right. So that takes us to the second level that we were describing, which is our brand new DC Heal apprenticeship. And this
Correct.
basically takes the programming from the advanced technical centers in health sciences and kicks it up a notch into the form of a year-long paid internship where you're learning all the time, getting more certifications. So it's like your first job, but it's remarkable because it's an apprenticeship job where you're being paid to learn. Yes, you've got to contribute, but that's part of the beauty of this. So as the year goes on, you get your certification, you'll actually even get paid a little bit more. So there's lots of incentives built in for your success. And that's what we anticipate many of our young people will choose to do. They've got their college credit certifications, they graduate high school, some will go to college to further their education, some will go directly into work, and some will go into these apprenticeships, which is a further way of promoting your education.
For the paid apprenticeships part of it, how do people get information on that? Or do they have to go through the high school part and then graduate into that? What are the steps?
The apprenticeship is called DC Heal, Heal, because it works with the caring professions, so DC Heal. And once again, the best way to access that is through your high school guidance counselor.
Okay.
And we are this year running a cohort of 20, and that's full. And we anticipate that we'll be expanding that over the coming months and years. So there'll be lots more opportunity to get access to this.
Nykirah, what would you say to one of your peers, a young person in the city, hearing this right now, and encourage them to try it out? What would you say to them?
I would say to give it a try, because you never know what you'll like. Like I said, I was at WHUR-FM in cybersecurity classes, trying something new, and realized I didn't like it, and later switched to the EMT pathway. I love it.
Oh, what an endorsement, Paul. I love it at the end. That's just fantastic. Oh my goodness. I want to make sure we follow your story, Nykirah, and see what happens. I mean, so you have a whole nother year of schooling to go, right? Before you graduate.
Yes,
Is that where we are? Huh? Say it again.
Say yes, I'm a junior.
Oh, yes. All right. Well, we need to keep up with your story, Paul. You make sure you keep track of her and let us know, because we love great updates on successful programs in the community, especially when we're talking about helping out young people. What would you say in your final thoughts, Paul, as Deputy Mayor for Education, about this opportunity in the city for our young people?
It's just another perfect example about how extraordinary our young people are. And it is the case that it is our job to ensure they've got opportunity and they've got access to opportunity regardless of where young people live. And so Nykirah is here telling her wonderful story because she's got access to this. She's so many friends that are like her. We unfortunately have a wait list of almost 400 students for these advanced technical center training programs, which simply means we've got to do more and more and more because it's up to us.
You've got to do more. You've got something good, and let's keep it going, and let's get more people in this. I love it. Paul Kihn, Deputy DC, at DC's Deputy Mayor for Education, and Nykirah Harper, who is a student at Cesar Chavez Public Charter Schools. Thank you so much, both of you, for joining us and sharing with us this fantastic program in the city. We are out of time now, so I want to thank you again. Tonight's conversation shows really what happens when we invest in our young people, because that's what it's all about. They are the future. That's the Daily Drum for this Thursday, October 30th, 2025. I'm Molette Green, happy to sit in for Harold Fisher tonight. Harold returns tomorrow. Have a good evening.